What we're going to do today is we're actually just going to look at the speaking criteria. So what I'm going to do, I'm just going to share my screen with you guys so you can have a look. Okay, so let's have a look at the speaking criteria. A lot of you are kind of familiar with this exam, and I know a lot of you have done this. So there's a lot to the criteria, and we're going to try and focus on the criteria. What we're going to do is we're going to look at a model answer. We're going to do a little bit of listening as well, and we're going to map it to the criteria. So first of all, let's just have a quick recap on what the speaking exam is. It's a consultation, so it's a role play between a patient and a doctor or a nurse or a pharmacist, depending on your profession. Remember, speaking, it's not everyone does their own speaking tasks. Doctors do their own, nurses do their own, and pharmacists do their own, and so on. So you'll have your own task. It's a consultation. It starts off with warm-up questions. You'll be asked a couple of questions, several questions, in fact. And these are not assessed. It's really just to get you to relax and feel comfortable with the interlocutor. And the person who is doing this is the interlocutor. They're not an examiner. In fact, they record your speaking on an audio and they're going to send it to Australia, and everything is marked by OET examiners. So the person you're working with isn't an examiner, they're just what we call an interlocutor, and they're going to be recording you. So you'll have a couple of minutes to get used to them with these warm-up questions. You're then given a role play card. On this card, you've got 3 minutes to prepare. You can write notes and you can highlight things, and these 3 minutes are really important. They give you these 3 minutes for a reason, so you really want to put these 3 minutes to good use. You can also ask the interlocutor any questions during this time. Once the role play starts, you can't ask any questions. So it's really important, if there's any words you're not sure how to pronounce, if there's any words you don't know the meaning of, you can ask. Of course, you can't ask how to start the role play and things like that. But generally, other questions around language, pronunciation, you can ask. It's important you use the 3 minutes just to plan your task. Guys, put these 3 minutes to good use. Think about what kind of patient you have. A little bit like the writing, every role play is different. So every patient is different. Some patients might be a little bit more difficult. Some patients might be perfectly fine. Some patients may need a lot of reassurance, or some patients may need a lot of advice. So try to identify what kind of patient you have, as that's going to affect how you interact with them. And of course, think about how you're going to open the role play. You get marks for opening the role play appropriately. We're going to have a look at an example, in fact, later on. Think about your language. You may need language of reassurance or language of advice, open and closed questions. There's all sorts of things to really think about. And we'll have a look at some of them in today's class. And also think about how long you're going to spend on each task as well. So really try to organize yourself in those 3 minutes. After the 3 minutes is up, then you start the role play. You've got 5 minutes to do this. You give back your card and you're given another card. And then you've got, you do the whole cycle again, 3 minutes to prepare, 5 minutes to do the role play. So you do 2 role plays, and it's going to take about 20 minutes, more or less. So the marking criteria, this is how you're assessed by OET examiners. You can see it's divided in 2. You have the linguistic criteria on the left, and you have the communication criteria on the right. The linguistic criteria is made up of 4 different criteria, and in total, you can see it's actually worth more than the communication criteria. So just going to have a quick look at both sides, but let's just focus in and zoom in on the linguistic criteria. These are the 4 criteria at the top: intelligibility, you've got fluency, appropriateness of language, okay, and essentially really grammar and vocabulary here as well. You can see you get a score from 0 to 6 for each of these. If we have a quick look at intelligibility, what this really means is just being understood. The examiners just want to know that they can understand you clearly. You can see here, hopefully you can see this on your screen. It says pronunciation is easily understood, and prosodic features such as stress and intonation, rhythm are used effectively. So you've got to remember here, this is a speaking exam and you've got to use your voice effectively. When you're speaking English, your voice goes up and down. It's not in a monotone, it's not just level. And you really want to kind of try to use that stress and that intonation. Let's have a quick look at an example here. How would you say the following? Just got a question here. Okay, I'm sure that's fine. Is your name Mr. Jenkins? You could say it in a few different ways, in fact. But you could actually use your intonation. For example, here, you don't even need to ask the question. You could actually just use the tone of your voice. So for example, you might just say, Mr. Jenkins. It's quite interesting. I think, let's just have a listen. Hopefully you can hear this.
Mr. Jenkins?
Okay, hopefully you heard that, but what happened, the voice actually, I'm just using my voice, or the speaker was using her voice to her intonation, so you understand it's a question. Her voice was actually going up. Let's just have another listen.
Mr. Jenkins?
Yeah, okay, so what's happening? On the second syllable, the voice is going up, it's rising, and we're stressing the first syllable. We always stress certain syllables in words in English. So I'm still stressing the first syllable, but the second syllable, my voice is going up. So I'm using the tone, so the intonation is really important here. And you can use your intonation in the exam. You can put it to good effect. Of course, you need to be sympathetic as well. Often you need to be empathetic, and you can use the tone of your voice to be sympathetic and empathetic. So it's really important. It's not just what you say, it's also how you say something. Let's look at another example. Let's look at stress. We've got a sentence here. So just call this number, speak to the receptionist, and book an appointment with the doctor. There are certain words and syllables that we stress in a sentence. And I wonder if you can hear which words are being stressed. So I'm just going to play an audio and just have a listen to this and see if you can identify which words are being stressed.
So just call this number, speak to the receptionist, and book an appointment with the doctor.
Okay, I'm just going to play that one more time. Have a listen carefully, and see if you can identify the stressed words and syllables.
So just call this number, speak to the receptionist, and book an appointment with the doctor.
What's happening in that sentence? Really, we're stressing certain words. I've highlighted the stressed words and syllables. And you can see here that really in English, generally speaking, we stress verbs and nouns and adjectives. We call them the content words. And again, my voice isn't totally flat, but it's almost like giving me rhythm. Just call this number, speak to the receptionist, and book an appointment. And sometimes speaking is like that. It's almost like music. There's a rhythm to it. And that's what stress does. It gives us rhythm. So as well as using intonation, you've also got stress as well. And this is something the examiners are listening out for. And this makes up intelligibility, the first part of the criteria. Okay, if we just move down here, and if I move to band 4, it says easily understood most of the time. Pronunciation or prosodic errors Remember, prosodic, it's just things like stress, intonation, your pace. So pronunciation or prosodic errors and accent at times cause strain for the listener. So it's fine to have an accent. Sometimes people ask me and say, you know, is it a problem? Is my accent too strong? Well, look, this is a language exam. The examiners know you have an accent. Everyone has an accent. Here in England, for a small country, there are numerous dialects and accents. Everyone has an accent. It's not a problem, as long as they can understand you. That's the most important thing. That's all they want. They just want to make sure that they can understand you clearly. So don't worry too much about your accent, as long as you're easy to understand. So we've got intelligibility. Got a picture here. You're probably wondering why I'm showing you this picture. Well, if you look at the river and you think, well, what does the water in the river do? The water is moving from, of course, one side to the other. It's moving in a nice kind of movement. It's smooth. Essentially, it's flowing. That's what the word I'm trying to get at is flowing. The water flows smoothly from one side to another. Flow is the verb, fluency is the noun. We can also make an adjective. I'm sure you know, fluent as well. You could make an adverb as well, like adding ly to the end of the adjective. You can say fluently. Okay, you could also say disfluent. There's lots of words we can make here from flow. But the reason we're talking about that is because the second criteria is fluency. And that's what they want. They want you to speak fluently without too many hesitations and pauses. If you look in the first band, in band 6, it says completely fluent speech at normal speed. So you're just speaking at a good pace, not too fast, not too slow. And then in the second bullet point, it says any hesitation is appropriate and not a sign of searching for words or structures. In other words, it's fine to hesitate. Everyone hesitates when we speak. We always pause, and we pause to think what we're going to say. So it's fine if you do hesitate. However, you've got to be careful, because as you drop down, what you notice here, when they talk about hesitation, it says hesitation may occasionally indicate searching for words or structures. So when you're going to hesitate, if you're trying to translate, that could be a bit of a problem. It's fine to pause, because sometimes you pause and you're thinking of what to say, and we have fillers. We have things like and that's fine. It's perfectly natural. However, if you're pausing because you're trying to translate, that could be a problem. So really try not to translate, because it really does interrupt your fluency. And if we drop down to band 4, you can see here now it says uneven flow with some repetition, especially in long utterances. Uneven flow, so it's kind of like staggered now. You're not speaking fluently. The second bullet point, it says some evidence of searching for words. So they can see now that you're actually trying to translate, you're not sure what to say, and it kind of suggests you don't have enough vocabulary as well. Okay, so fluency is really important. Fine to pause, but try not to spend too much time saying, it's perfectly natural to do that. The problem, I think, is really when you start to translate and you're searching for words as you translate, because that really interrupts your fluency. Okay, let's keep going. We've got appropriateness of language. So using appropriate language. If you look at the first bullet point, it talks about it says entirely appropriate register, tone, and lexis. So lexis is, of course, vocabulary. So using appropriate vocabulary. And register and tone. Register, really, they're talking about formality. When you think about your writing, you're writing to another often to another medical professional, sometimes to a carer or parent. It might be a non-medical person, but you're writing a professional letter and it has to be formal. However, with the speaking, you're now talking to a non-medical person, and it's quite nice if you can stay relaxed and actually be informal. So, for example, let's have a look at this. Which is the best sentence? What's your problem? How can I help you? Now, it's quite obvious. You're not going to start a role play in a consultation by saying, what's your problem? It's almost rude. It's just too direct, and it's inappropriate. It's the wrong register. It's far too informal. How can I help you? It's a lot better. It's politer and just generally nicer. What about these two? May I please address you as Mr. Smith? Do you mind if I call you John? Okay, have a think about that. May I please address you as Mr. Smith? Do you mind if I call you John? Well, it's interesting with the chat. I know a lot of you may think the first one is more appropriate, but in a way it's a little bit too formal. With the speaking, you get marks for building up a relationship with the patient, and you don't want to be too formal. In fact, you want to kind of stay relaxed and keep it a little bit informal as well. You want to be approachable. You want the patient to ask you questions. You don't want them to be afraid of you or to be scared of you. So keep it informal. Don't be too much of an authority figure. So in this instance, I think the second sentence actually is a little bit better because the first one is rather formal. Okay, and finally here, subcutaneously administer the injection as a bolus into the subcutis, the layer of skin directly below the dermis and epidermis. Okay, I'm sure you can see what's wrong with that. Remember, you're talking to a non-medical person, a patient who has no medical knowledge. So that's completely inappropriate. You've got to avoid using medical words. And it's just a lot simpler. So you just need to inject yourself here. It's basically a lot more simpler. And so you can see you've got to avoid these medical words and just keep your language simple. Okay, so using appropriate register, don't be too formal in the speaking exam. And finally, we've got here, we got resources of grammar and expressions. So really, this is where your language comes into it. Using a wide range of vocabulary, the examiners are listening out for your tenses and just generally they're listening to your grammar. Also, it says using idiomatic speech, so you can use informal language as well. Like I said, it's very different from the writing. It's a different type of English now you're being assessed on. If I move down, you can make grammar errors, it's fine, as long as they don't interrupt the fluency, a little bit like your writing. It's fine to make kind of minor errors, as long as they can understand what you're trying to say and they can keep reading. It's the same with speaking, as long as they understand what you're trying to say and you can just keep speaking, it's fine. And it is important, I forgot to say, don't overcorrect yourself because that is going to interrupt the fluency as well. Okay, let's move on. Here you can see, okay, I mean, we're not OET examiners. The only guys who can really tell you how they mark are the people in Australia who mark the papers. We're all teachers. As premium providers, we've done some training with people like Rebecca, and we worked, but we're not examiners, but we can guide you. I can't tell you exactly what score you need to pass, but generally when we study and we do the course, we do aim to get into the top 2 bands with speaking. Okay, so that's the linguistic criteria. And just a quick look at the communication criteria. What we're actually going to do is look at a sample task. But before we do, this is the communication criteria. You can see it has 5 different criteria. You've got relationship building, understanding and incorporating the patient's perspective, providing structure, information gathering, and information giving. Okay, so this is what the examiners have. They have something like this. This is their mark sheet. You can see the 5 criteria here, and you can see with each criteria you get a score of 0 to 3. Okay, and what we're going to do, we're going to have a look really at a sample answer, like I said, and we're going to try and map it to the criteria. Okay, guys, and feel free to really just put any questions into the chat that you like, if you want to ask anything. So we've got the practice task here. Let's have a look at this. This is a role play card. And don't worry, if you're a doctor or a pharmacist, or if you're from any other profession, don't worry, because you'll find this useful. Regardless of your profession, everyone is marked according to the same criteria, and a lot of the techniques are very much the same. So please keep watching, even if you are of another profession. We're just going to have a look at a nursing task here, and you will find it useful. The setting, of course, one of the first things you want to do, this is in A&E, looking at accident and emergency. You've got a little bit of context here. This says the patient is presenting with a minor cut on the sole of his or her foot. Having examined the cut, you decide that it needs to be cleaned and bandaged. It's really important you read this context clearly, because it kind of gives you some information. With this particular task, it doesn't actually tell you a great deal of information about the patient. You don't know if the patient is anxious. You don't really know if the patient needs a lot of reassurance, or if the patient is stressed. So it doesn't tell you too much, but with a lot of cards, sometimes they will give you clues as to how the patient is feeling. Okay, so we've got the context, and then of course you've got your tasks to do, and they all start with verbs. And these are essentially your tasks. These are what you're going to be doing. You're going to be finding out, you'll be informing, you've got to convince, reassure, and ensure the patient understands. So one of the first things that I always do is to underline the verbs at the beginning of each task. And again, in your 3 minutes preparation time, you might want to think about how long you're going to spend on each task as you try to organize this role play. Okay, the interlocutor, remember they're not an examiner. The interlocutor also has a task. This is their card. It's very similar, it tells them the setting. They also have background information as well, and they have tasks to complete as well. So essentially, the way these role plays have been written are for you to create a dialogue. You have your task and the patient has their task, and you make a conversation together. It's not you speaking for 5 minutes. It's not a monologue, but you're actually creating a conversation. You're creating a dialogue. And that's why it's got to be patient-centered. It's not all about the medical professional. It's not all about the nurse or the doctor, but the patient is really important. So that you can see how the tasks have been written, they've actually been aligned together so you can create this dialogue. And it's really important to listen to the patient, of course. The problem is in the exam, you can't see the patient's tasks. You don't know what the patient is going to say. This is all you see. You only have your card. And that's why it's so important to listen to the patient, because depending on what the patient says, that really determines your next step. You're not sure what you're going to say until the patient has said something to you. You've got to respond to the patient. You may have to say something important, and you're going to start a kind of mini conversation before you go on to your next task. They might not say anything significant, and you can just go on to your next task. But essentially, guys, what I'm saying is you've got to listen to the patient. I know it's a speaking exam, but listening is a really important part of this exam. Essentially, what you're doing is this. You have your card, you do your preparation, and then you do your first task. So you then speak. Try not to read off the card because it changes your pronunciation. I always keep my card down in front of me, so I have it there for reference, and I have notes and I highlight things. But when I'm speaking, I'll just look at the patient, and I try to get into the role, in fact, and really imagine that I'm in a consultation. But try not to read from the card. Just speak naturally if you can. Once you have spoken, the patient will respond to you. The patient may say something, and this is where it's really important that you listen. Depending on what the patient says, you're then going to respond to them. After this, you're going to move on to your next task, and you do the whole cycle again. Essentially, guys, you're reading your task, you're then going to speak, you're then going to listen, and then you're going to respond to the patient. And then you move on to the next task. And that's what you're going to be doing for 5 minutes. This makes it patient-centered, where you can create a dialogue. Okay, let's go back to this task. So this is the task we're going to look at. We're going to look and listen to a sample answer. The question is at the top. It says, how would you open this role play? It's an interesting question. How would you open this role play? Well, the setting is A&D, accident and emergency. It tells you here the patient is presenting with a minor cut on the sole of his or her foot. Having examined the cut, you decide that it needs to be cleaned and bandaged. So you've got to open the role play appropriately. If we go to the criteria with relationship building, you can see here it says initiating the interaction appropriately, greeting, introductions, nature of interview. So initiating the interaction, in other words, starting the role play. So the the interlocutor will be waiting for you. The patient won't say anything. They'll be waiting for you to start the role play. So it's important you start the role play in the right way. We've got a couple of examples here. See what you think. This here, it says, hello, I'm Nurse Smith. What's your name, please? It's John Williams. Okay, John, I'm just going to examine your foot. Or we have this. Hello, I'm Nurse Smith. What's your name, please? John Williams. Is it okay if I call you John? Sure. So, John, how can I help you? Or we've got this one here. Okay, John, so I've just examined your foot. And okay, you've got three different ways to start this role play, but really only one of them is appropriate. I think with A and B, a lot of people might say A and B, but you've got to read the card carefully because you're in the middle of a consultation. They like to trick you in OET. Nothing is that straightforward or that simple. You don't know how you're going to open your role play until the day of the exam, until you look at your card. Sometimes you may need an introduction, you may have to give your name, you may have to get the patient's name. Other times you may know the patient, you may know what the issue is. So there are different ways of opening a role play. Here, actually, you're in the middle of a role play, so you can assume you've actually already done the introduction. In many ways, I think option C would probably be the best way, because remember, guys, you're not at the beginning of the role play. Sorry, you're not at the beginning of the consultation with this task. So really just take care when you open your task. You can't plan ahead and think, this is what I'm going to do. You may think of several different ways that you can open your role play. And then on the day of the exam, you'll think, okay, this is what I need to do. So with this task, it's probably better you can assume you've done the introductions already and you can go straight into the task. This was your first task. It said find out how and when the injury happened, what the patient did after the accident occurred, and if they have applied anything to the wound or taken any medication. Okay, so The task is find out. So this is information gathering from the criteria. You've got to collect information. You're going to find out. And questions are important. We've got an open question here. And then we've got, if you look closely, there are 3 other questions. In fact, you've got to find out 4 bits of information. So like I said, during the 3 minutes preparation time, use it wisely, really analyze each task. Here, actually, you've got to find out 4 things. And I underline and I write numbers. I can see my first question will be an open question, and the other 3 are all specific. They're all asking for certain things. Okay, so that's what I'm going to do with my card. On the Interlocutor, it just says, on their card, it says, answer the doctor's questions about how you got the cut. Of course, you don't know that, you don't get to see that. But you can see how the tasks go together. They're going to be waiting for you to ask these questions, and they're just going to answer the questions. Okay, so guys, what we're going to do, you can see a dialogue, but I'm just going to ask you to follow it if you can, please. And I'm going to play the audio. So remember, it's a speaking exam, and you can kind of listen to the way, particularly the nurse really is speaking in this task.
I'm just going to ask you a few questions, if that's okay.
Sure, that's fine.
Could you tell me what happened, please?
Basically, I was walking in the garden when I stepped on some broken glass. I don't know where it came from. I just felt something in my foot.
I see. When did it happen?
About a couple of hours ago.
Okay. And what did you do next?
I put my foot under some running water, then wrapped a bandage around it, and then I came here immediately.
Did you use any cream or ointments?
No, nothing. I just used a bandage.
And have you taken anything? Any medication?
No, none.
Okay. So you stepped on a piece of glass, washed and bandaged your foot, and came here straight away?
That's right.
And you haven't taken anything or applied any creams?
No.
Okay, John. Thanks for that.
Okay, hopefully you picked up some of the intonation and the stress that we talked about, and the tone of the nurse's voice was very nice, kind of fairly gentle as well, but very confident as well, a very confident speaker. If we just analyze this closely, these were the questions then on the task. Remember, it said find out. And I had 4 bits of information to find out. I've broken this down. There are 5 questions here. What you realize, I started with an open question. The other questions were all closed questions. Okay, and if I just show you this on the criteria, information gathering. Every time you see find out, that's what you're doing. That's what they're listening out for. Gathering, collecting information. So information gathering, I'm just going to zoom in here. And you can see here using initially open questions and appropriately moving to closed questions. This is really common in kind of medical English, and it's what a lot of you guys do anyway. I know you start kind of generally, and then you look for specific things. So many of you do this anyway in your jobs. You start with open questions and you're moving to closed. But here you can see you get marks for doing this. So I've managed to tick the boxes, this particular box, by starting with open and then moving to closed questions. Also, you can see here with point 3, it says not using compound questions. So really not asking questions together, basically, but breaking up your questions. Don't confuse the patient by asking them 2 or 3 questions in one go. You've got to ask them one question, let them answer, ask the next question, let them answer. So just break up your questions. Okay, and that's what this student did. The questions were all broken up, which is great. Also, we had the first question was indirect question as well. So we'll look at this kind of indirect language because it is really nice to use. You have direct questions, and these are often WH words. For example, what's your name? Or can I ask you some questions? When did the symptoms start? Okay, cool. Can I isn't a WH word, but it's a direct question. We've got these direct questions, but what we can do actually to make it a little bit more politer, we can make them indirect. And we can use these almost introductory parts of a question, such as, could you tell me? Or do you mind if? Or would you mind? So the question then becomes indirect. And it's a nice way of forming questions. It's really quite a polite way of speaking, in fact. So what's your name? You could say, could you tell me your name, please? Rather than what's your name, you could just make it indirect. Again, can I ask you some questions? Could say, do you mind? Do you mind if I ask you some questions? Perfectly fine. When did the symptoms start? Would you mind telling me when the symptoms started? Okay, just make sure grammatically you know how to form indirect questions as well, because it helps if it is accurate. Remember, in the linguistic criteria, there was one category which was basically grammar and resource, lexical resource, which is vocabulary, but also grammar. So make sure you know how to form your questions accurately. And commonly, in fact, you see that task a lot, find out, find out, find out. So you're always asking questions, and it's really worth making sure you can form your questions grammatically accurately. Okay, so these are indirect questions that we're looking at here. They're, like I say, kind of a bit more politer. They're also really useful because they're softer and they're more gentle as well. And yeah, resources of grammar and expression, that's kind of just what I was talking about as well. So indirect language, it would be noted by the OET examiners, I'm sure. Okay, and appropriateness language as well. Remember that first bullet point, entirely appropriate register, tone, and lexis. So it's a nice way of speaking, and it is completely appropriate, in fact, for the speaking in a consultation when you're speaking to a patient. But let's go back to this role play. So we've got open and closed questions. We looked at indirect questions, breaking up questions. And for all of these, we're getting marks as well. You're ticking certain boxes in the criteria. If you look at the beginning, the nurse said, I'm just going to ask you a few questions. That's a kind of a really nice thing to do. It's actually signposting. Signpost is you're telling someone in advance what's coming next. For example, okay, we're just going to have a chat about your diet and lifestyle. So I'm telling the person in advance what we're going to talk about. And this is a really nice thing. This is called signposting. So I'm not just asking questions, but I'm actually letting the patient know that I'm going to ask them some questions. Again, I'm going to zoom in on the criteria. Here it says providing structure. And you can see in point 2, it says signposting. Okay, signposting changes in topic. Well, this is at the beginning here. So you're not in the middle of a consultation, but you're still signposting, so it doesn't really matter too much. And you can use this throughout the role play as well. But signposting is really useful. And as you can see, it's something they're listening out for. Okay, so I've got a bit of signposting. Also, if that's okay, it's kind of a small thing, isn't it? But again, I'm being polite here. I'm not just saying to the patient, okay, I'm going to ask you some questions, but I'm just being polite. I'm going to ask you some questions if you don't mind, if that's okay. Yep, great. You know, again, I'm making it a little bit more patient-centered. And I remember you want to be approachable, you want to be polite, and you want the patient to ask you questions. So it helps if you kind of involve them in the role play and just little things like that, if that's okay. So it's just a polite thing to do. So really good. If you look at relationship building here, the second point, demonstrating an attentive and respectful attitude. In a way, it is just being respectful here. That's all you're doing just by saying something like that. It's a nice thing to add on sometimes as you go throughout your speaking exam. So of course you're being respectful. Something else I'm just going to highlight here. The nurse asked her questions, the patient gave answers. And then the nurse basically said this sentence. Okay, so you stepped on a piece of glass, washed and bandaged your foot and came here straight away. What the nurse was doing here, the nurse was actually paraphrasing. And sometimes this is a useful thing to do. You want to be clear in your head that you've understood the patient. The patient has given you some information and you need to be clear that you've understood them correctly. So it's really nice to paraphrase back to the patient so you can be clear that you have understood them correctly. It's also nice for the patient because the patient understands that you have been listening to them and that you understand them. So sometimes when it is important information, it's really worth paraphrasing back to the patient. If you look here, again, I'm going to zoom in here, information gathering. Just zoom in. You can see here with point 4, it says clarifying statements which are vague or need amplification. So you can, when you're paraphrasing, you are kind of clarifying as you do that. Also point D5, at the bottom it says summarizing information to encourage correction or invite further information. So again, summarizing information, that's paraphrasing there. And maybe you haven't understood the patient correctly and they can correct you and say, no, actually, sorry, doctor, or sorry, nurse, but this is what I mean. So basically paraphrasing, it can be a useful thing to do, but only sometimes. If it's really basic information, don't paraphrase, only if it's something significant, because it wouldn't make sense if you're paraphrasing something very easy to understand. Okay, so you can see it's there in the criteria. If you look at the criteria and just looking at that first exchange and looking at the communication criteria, these are the boxes that I've ticked so far. And that's just comes from one exchange here. Okay, so guys, let's move on. Let's keep working because we're going to look at the listen to a second task as well. You found out, you gathered information, and you've been listening and you've done all the first task. Now you go on to the second task. It says here, inform the patient that it is only a superficial cut and that stitches will not be required. The wound needs to be cleaned and bandaged. Okay, now you don't get to see the interlocutor's card, so you don't know, but this is what it says. It says, insist that the wound needs stitches in order to heal effectively. So your task is to inform. So now you've gathered information. This is information giving. You're going to give information. You've got to inform the patient. A lot of role plays are written, so there's a little bit of conflict, or there's a little bit of tension. Not a lot of tension, but a little bit of tension. Sometimes the patient might not be happy. You may have to kind of just reassure them or give them some extra advice, or you might have to try to persuade them. Here you can see the verb on the patient card. It says insist. It's quite a strong verb. And I mean, it's difficult because you don't know the patient is going to insist on something. And that's why it's so important to listen. So what's really going to happen here is that we've got a small bit of tension, a little bit of conflict. It's not a big thing, but let's see how the student deals with this. Okay, I'm just going to ask you to listen as you read. And again, just listen to the pronunciation of the speaker and her intonation, her tone, and the pace, and all these different, we say the prosodic features or intelligibility. Okay, guys?
The good news is that it's not a serious cut and you won't need any stitches. What I'm going to do is clean the wound and then bandage it for you. How does that sound?
Are you sure? I think it'll heal better with stitches.
I know why you'd say that, but there's really no need. We'd only use stitches if it's a deep cut, but as it isn't, it's going to heal fairly quickly. Please don't worry.
you sure? I'd rather have stitches to make sure.
There's really no need. With a bit of care, your foot will heal within a week or so. It really is a minor injury.
I'd feel better with some stitches, then I know it'll heal for sure.
I do understand, but it really is unnecessary. Stitches won't make any difference to the healing process. If you have any difficulty, then come back and we'll look at it again, but I'm sure your foot will be fine with a bandage.
Okay. Okay, guys, hopefully with the speaking, you were able to take note how the speaker, the nurse, was stressing certain words, and also her voice was generally moving up and down. But she kept her voice sympathetic, and it was quite gentle as well. If we look at the task here, okay, this is a nice thing to do. What I'm going to do is really, again, you're signposting, you're telling the patient in advance, but also it's a nice kind of grammatical thing. It's a nice little structure to use as well. How does that sound? Patient-centered, you're involving the patient. You're not just lecturing to the patient and telling them, you're going to do this, 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 but you're involving them. How does that sound? So you're inviting them in and making it patient-centered. I know why you say that. Again, it's a nice little phrase as well. You're taking into consideration the patient's perspective. The patient wanted some stitches. They didn't need stitches, but you didn't dismiss the patient. The nurse didn't just say, no, look, you don't need stitches. Actually, they took on board what they were saying, and it's a nice thing to say. I understand why you say that, or I know why you'd say that. And also here, you're being empathetic, and there's marks as well you get for being sympathetic and empathetic. Lots of phrases here. In fact, please don't worry. You're offering reassurance to the patient as well. And you're explaining as well. You're explaining why it's important, why stitches really aren't that important. So there's a lot there that the nurse did in that task. Again, I do understand. Again, you're giving sympathy here. Sympathy, empathy, reassurance, and using the tone of your voice as well. Don't forget, it's not just what you say, but it's also how you say it. Okay, if we look at the criteria, and we can add a few things here, and you can see now I've ticked a few more boxes as well. We've got, if you look at the first box, indicators of relationship building. If you look at point 4, it says showing empathy for feelings, predicament, or emotional state. Showing empathy, you can see there you get marks as well. In B1, eliciting and exploring the patient's concerns, ideas or concerns. And that's what the speaker was doing. The patient was concerned, the patient wanted more stitches, they thought they needed stitches. And like I said, the nurse didn't just dismiss this, but she listened to the patient and they talked about it. So you can see here, exploring the patient's concerns. Again, I've ticked another box. Sequencing the interview. We'll come back to sequencing. And sequencing, it's a nice thing as well. It's using these words like firstly, secondly, and then. And so things go in sequence as well. Okay, and at the bottom as well, if you look at the bottom criteria, it says indicators for information giving. Remember, that's what you were doing. You were giving information. It said inform, so you were informing the patient. There's a couple of things here. The second point says pausing periodically when giving information and using the response to guide next steps. The nurse didn't just give a whole load of information and just go to the next task. Actually, the information was almost minimal, and she paused as well, which invited the patient to speak. And you can see just for using those pauses to allow the patient to speak, you can kind of get marks here. And like we talked about before, encouraging the patient to contribute feelings as well. In a way, just making it patient-centered and making the dialogue as well. It wouldn't have been good if you had just kind of explained everything to the patient and gone on to the next task. You've got to let them ask you questions and raise concerns, and you've got to listen to their concerns and respond to them. Okay, guys, so we're ticking more boxes as we go along, and let's keep working because we get to the next task here. It says now, convince the patient that antibiotics are not necessary as the wound is not infected. Now you can see here the word convince, and that's telling you something, and you really want to try to pick up on these little things because it's telling you the patient isn't just going to say yes, yes, yes. But if you've got to convince the patient, it means they're going to be a little bit resistant and you're going to have to persuade them. So you know in advance here, during the 3 minutes, as you're underlining those verbs, you know it's something to think about. Okay, I might have to spend a little bit longer on this task here because the patient isn't just going to say yes. So you're going to have to convince the patient. This is the patient's card. It says, ask for some antibiotics to ensure the wound doesn't become infected. You believe antibiotics are essential to prevent infection. Of course, you don't see that, but you can see how the task has been written so you can create a dialogue. Okay, let's have a listen then to the sample answer. And again, just listen to the speakers, to things like the tone of her voice. Is it going up and down? Can you hear which words are being stressed as well? Can I have some antibiotics just to make sure it doesn't become infected?
Well, antibiotics won't help at all. As I said, it's just a small cut. And as long as you keep it clean and bandaged, you'll be absolutely fine.
But I don't want it to get infected.
I do understand, John, but the chances of that happening are highly unlikely. Antibiotics won't make any difference.
But it's worth it as a precaution, isn't it?
No, not really. It's a minor cut, and as long as you keep it clean and bandaged, you'll be fine.
If you're sure.
I am. If you feel as though it isn't healing, then contact your GP in a couple of days and they'll look at it.
Okay. All right, guys. You can see here, again, the nurse didn't dismiss the patient. The nurse didn't say, well, look, you don't need antibiotics, and she just moved on to the next task. But actually, they talked about it. They explored the patient's concerns. And we've seen already that's in the criteria. She used pauses as well at the end, inviting the patient to speak. And we talked about that already down at the bottom with information giving, using pauses, exploring the patient's concerns. Okay, and also understanding and incorporating the patient's perspective. So that was in point B3, relating explanations to elicited ideas or concerns. So really actually just being considerate, if you like, and not dismissing the patient, even though what they say is completely irrelevant or it just doesn't, it's not important. Remember, they're not a medical person and they don't really know. They may think they know, and so you can't just dismiss them. You've got to really just be empathetic, if you like, not just sympathetic, but try to put yourself in the position of the patient. The patient has got a cut there, they've got a little bit of pain, they're panicking a little bit, they've got no medical knowledge at all, and they're scared of it being infected. You know, really try to put yourself in their position. Think, how would you feel if that was you? And just being empathetic can really, really help. Okay, guys, we've got to keep moving. There's lots of things here. We've got reassurance. You'll be absolutely fine. The chances of that happening are highly unlikely. So again, just a couple of nice ways to reassure the patient as well. The next task, actually, it starts with reassure. It says here, reassure the patient that his or her foot will be fine in a week, but advise against doing any rigorous sporting activities at the weekend. You can see the verb is reassure. And you can see, actually, you've got another task. So that's something else to do in your 3 minutes. Like I said, really analyze the tasks, because you have tasks within tasks. A little bit like where the first question said, the first task said find out. When you look closely, there are actually 4 things to find out. Here, when you look closely, it's actually 2 tasks. You've got to reassure, but also you have to advise as well. This is the patient's card. It says express concern. You may not be able to play any sport. You usually play football at weekends. Once again, you can see how the tasks have been aligned. The patient's going to express concern and you're going to reassure. It's been written in a way so you can create that dialogue. Okay, let's have a listen to the sample answer. I need my foot to heal quickly because I play football at the weekends.
I do understand, John, but I'd strongly recommend that you don't play this weekend. Your foot needs a few days rest, and if you do play this weekend, you risk aggravating the wound.
But I don't want to miss football. I play every weekend.
I understand, but you really are better off just resting this weekend. It really is in your own interest. It'll only take a few days to recover, so you should be fine for next weekend.
It's a shame.
You could always try swimming, something where you don't have to put any pressure on your foot.
Okay, so it'll take about a week to recover and I'll be fine next week?
Yes, like I said, it really isn't a serious injury, so please don't worry too much. You just need a bit of rest and I'm sure you'll be fine next weekend.
Okay. Okay, hopefully you got... Sorry. Hopefully you got something there from the speaker's voice and the way she was speaking as well. Again, it is a speaking exam, and the tone of your voice. I keep saying that her pace was very good, speaking very fluently as well, very clearly, and stressing words as well. And all the time, her voice was fairly gentle and sympathetic as well. If we look at what she was saying, yeah, she explained clearly as well throughout the role play. Remember, the task said reassure, and you can see there were lots of things in here. I do understand. It's really in your own interest. It'll only take a few days to recover, so you should be fine for next weekend. It's a nice way to really reassure the patient. Look, you're going to be okay. Give it a week, and just see how you are. You'll be fine. Things like that are really nice in the speaking exam. You don't always have to say, "Oh, I'm so sorry. Oh, that must be awful." But there's lots of ways you can actually reassure the patient. Again, at the bottom, it really isn't a serious injury, so please don't worry too much. You just need a bit of rest. I'm sure you'll be fine. So again, you can see how the nurse here was really reassuring the patient, really by explaining and just little phrases as well. Please don't worry too much. I'm sure you'll be fine. Just nice little phrases. And again, just saying it in a nice way as well with the intonation of your voice. We got something here. You could always try swimming. What you're doing is you're providing alternatives as well. The patient wanted to play football. And again, you didn't just say, well, look, no, you can't play football. You need to wait. You need to wait a week and then maybe you can play football. But it's a nice thing as well. You are giving alternatives. Try swimming, or look, perhaps there's something else you can do. Maybe you can just go for a long walk or something. But it's a nice thing to do. Sometimes you need to negotiate with the patient when you're giving advice. A patient might need to stop drinking coffee and they're going to say, no, I don't want to stop drinking coffee. And what are you going to do? So it's nice to give alternatives or negotiate. Well, okay, you drink 5 cups of coffee a day. Can you cut down to maybe 4 for a week and then see how you feel? Rather than just saying, well, you need to stop and then that's it. And providing alternatives, it's a useful thing when giving advice as well. So negotiating and alternatives and giving alternatives. When it says advice, it's something you can do. This is the criteria. You can see we're kind of like ticking more boxes as we go along. We talked about that earlier. As we go through, these. Yeah, we're just ticking more and more boxes as we go along. This is the final task. It says, ensure the patient understands that the bandage needs to be changed daily, preferably after showering or bathing, and demonstrate how to change a bandage if asked. So ensure, that's the verb. Ensure what? Well, ensure the patient understands. You're going to show them how to change a bandage. And demonstrate. So you've got another verb. So there's a couple of things there. If you really analyze the task, read carefully. You can see there's two tasks again. You've got to make sure they understand how to change a bandage. You've also got to demonstrate how to do this. And they're going to ask you, this is all it says, ask to be shown how to change a bandage. You can't see the patient's card, but you can again see how the tasks have been aligned together, so you can create a dialogue. Here's an answer, and let's have a listen.
You do need to ensure that you change your bandage regularly, preferably after showering or bathing.
Okay, so can you show me how to change a bandage, because I'm not too sure how to.
Of course. So first of all, unravel the bandage slightly.
Okay.
Then just gently wrap the bandage around your foot. Don't do it too tightly because it'll only feel uncomfortable, but make sure it's firm.
Okay.
Then once you've been round a few times, just cut off the bandage and use the safety pin to fasten it. How's that? Do you think you can manage?
I think so. It seems fairly straightforward.
Great. So if it's okay, I'm just going to clean the wound for you, then I'm going to bandage it. And then you can be on your way. And I'm sure your foot will be absolutely fine in a couple of days.
Okay, thanks, nurse. Okay, guys, I hope you managed to get something from the speaker and the nurse and the way she was speaking. She was really stressing certain words, and again, the tone of her voice was very gentle, was very nice as well. And again, the pace of her speech was really good. It wasn't too fast, it wasn't too slow. If we look at what she said here, there are some words here. These are sequences. I mentioned these earlier. Firstly, secondly, thirdly. Here the speaker said, first of all, then. So she was sequencing her role play. And it's a nice thing to do because it does provide structure. And you get marks for doing that as well. How's that? Do you think you can manage? So this was a nice thing as well, because when you're giving information and you're giving instructions, it is important that you clarify, that you check the patient has understood. The speaker, she didn't just move on from one task to the next. She paused and she stopped and she actually invited a response from the patient. So it's really important whenever you give information that you do check the patient has understood. And you can see there, if we look at here, providing structure using organizing techniques as well. We had sequencing, we had signposting, and just down at the bottom, it says information giving. And I've just highlighted, hopefully you can see that. It says checking whether the patient has understood information. So whenever you're giving information, especially if it's important information, it is nice. And it's just really a small thing. Are you okay with that? Is that okay? Do you want to ask me anything? How do you feel about that? Just a small thing at the end, really, when you're giving instructions. Checking to see whether the patient has understood. And just down at the bottom, this is a nice thing to do as well, particularly if you find that you finished before the 5 minutes. It's nice to recap, in fact, the whole consultation, just the main points. But here in this task as well, the nurse just recapped for the patient, the main points as well. I'm just going to clean the wound for you, then I'm going to bandage it. Then you can be on your way. I'm sure your foot will be absolutely fine in a couple of days. And she's still reassuring. I'm sure your foot will be absolutely fine in a couple of days. So throughout the whole role play, actually the nurse was giving reassurance. So don't feel as though you only have to reassure when you see the task where it says reassure. Some role plays you're going to have to reassure throughout the whole role play. And this was a nice way to end the role play. The patient or the nurse was able to basically summarize the whole consultation. So we call that recapping. If we look at the criteria, this is really all the boxes that the student managed to tick. And she pretty much got everything here. But one thing missing, adopting a non-judgmental approach. I think the nurse did that. Don't put your own views or your own opinions into this. Don't be judgmental. And I think the student did that. She remained completely unbiased and objective. So relationship building was pretty good. Again, here it says, I've highlighted picking up the patient's cues. So it's really listening to the patient. And again, I think this student did that really well. She paused a lot and she was always inviting responses from the patient. Here we got information gathering, one box we didn't tick, facilitating the patient's narrative with active listening techniques, minimizing interruption. She never interrupted the patient, and it's really important that you don't interrupt the patient. Let the patient interrupt you, but don't interrupt the patient. And that's really what the nurse did. She never interrupted. Listening techniques, really, like I say, it's a speaking exam, but listening is so important in the speaking exam. And when the patient is talking, listening techniques are often things like, okay, I see. Just little things like that. It shows you're listening to the patient. And again, you can see you actually get marks for doing this. Okay, so really the speaker, I think if you look at this closely and look at the criteria, great, perfect. They've done really, really well here. Like I say, I'm not an examiner. We are teachers, we are OET teachers, but we're not examiners. Only the people in the official examiners in Australia can really tell you how they score. But generally speaking, you can see here that the student has scored really well. She's ticked a lot of the boxes here. Okay, and with intelligibility as well, if you think about, this is the main part of the criteria, you got more marks here. The intelligibility, yeah, she was easy to understand, great pace, her intonation, the tone of her voice was good. She spoke fluently. There were hesitations, but they weren't inappropriate. And her language was good, it was simple. And no technical terms used. She was quite informal, in fact, and some nice grammar as well throughout the role play and vocabulary. So I think she would have scored quite well in this part of the criteria. Okay, sorry, let's just go on. So yeah, so just to recap a couple of points here. With the card, you know, think about the setting, think about the background information as well. Think about where you are, because it affects how you open the role play. And you've got to open the role play in the correct way. You might be in A&E, you might be doing a home visit, you might be in a surgery, you might know the patient, you might not know the patient, you may know the main complaint, you might not know the main complaint. There's a lot of things to think about. So really read the card carefully, think about where you are, and use that context they give you to get as much information about the patient that you can. Also remember to underline the verbs. That can really help you as well. These are the tasks that you do. And remember, you get tasks within tasks as well. So really read carefully those, your card, put those 3 minutes to good use. We talked about opening the role play appropriately. Think about how much time you will spend on each task as well. We talked about the type of patient you might have. Some tasks you're going to have to reassure a lot. Some tasks you don't need so much reassurance, but you might have to give advice to the patient. Other tasks, the patient might be a bit difficult. So think about the type of patient you have and how you're going to interact with the patient and what you're going to say to the patient. And remember, you can ask any question you like within those 3 minutes. once the role play starts, you can't ask questions. So if there's any words you don't know how to pronounce or you're not sure about the meaning of, you can ask the interlocutor. Keep it patient-centered. Remember, it's not you talking for 5 minutes, but you've got to create a dialogue. We've seen how they've written these role plays, so you can create a dialogue. So involve the patient as you create this dialogue. We've talked about the importance of listening to your patient and responding to them. It's so important. If you don't listen, then you can't respond and you don't really know what you're going to say. In many ways, it's the patient who guides your next step. So it's really, really important that you do listen to the patient. Appropriate language, you may have to use language of reassurance or advice. Remember, you're dealing now with a non-medical person, so keep the language simple. Don't use medical terms as well. We talked about indirect questions as well. It's really worth kind of learning more about these because it's a nice, polite way of speaking. And generally, you know, your grammar, remember you are marked on your grammar as well and your vocabulary. And be confident and polite. Remember, it's a speaking exam. Think about your intonation and stress, word stress, sentence stress. Speak at a good pace and speak fluently, not too many pauses and hesitations. And be confident as well as you speak. All right, guys. So, yeah, I hope you found that useful. There's, just to let you know, if you check out wles.net, you can find kind of all sorts of things which can help you. There's an online speaking course that we do, which if you do need help with speaking, please check it out. You do watch video lessons, and then you work with a tutor as well. You have a few practices with a tutor. So you initially watch videos, you do the lessons, and then you're going to work with a tutor. I think you have 3 lessons with a tutor where you actually practice the role play and you get feedback as well. So if you do need help with speaking, check out wles.net and check out our online speaking course because you will find that really useful. There's, of course, there's stuff there for reading, listening as well, and of course writing as well. There's lots of stuff there if you need help with anything else in the exam. Writing correction service, a lot of you have been doing this, in fact, where you don't really want the lessons, you really just want to do a task and then get the feedback. So if that's what you want to do, it's fine. You can think about doing this as well. Check it out, wles.net, it's all there. There's packages as well. A lot of people want something comprehensive. If you want something comprehensive which covers everything, check out the Platinum package because that's the one a lot of people actually go for and a lot of people find useful. But everyone is different. Just check it out, wles.net, see if there's something there. These are the packages. It's all there online. This is who we are, guys. We're here in West London, in Ealing. In the middle, you can see Beth. Some of you have worked with Beth. In fact, if you're here in London, Beth is currently, she's teaching on the 4-week course. So we've got doctors and nurses currently working with Beth at the moment. Catalin, actually, she's an interlocutor here in London as well. And she's been involved with OET for a long time. And so hopefully if you are here in London or if you come online and work with us, hopefully you'll get a chance to meet Catalin as well. She's great. And if you are here in London, of course, we are open, the usual stuff, socially distanced classrooms, etc. But we're running our face-to-face courses here in London. So check us out. If you're here, come in. If you need advice about OET, if you want to talk about OET, we're always happy to talk about OET, even if you just want a bit of advice. So please do get in touch. Or check us at wles.net. Okay, guys, if you've got your exam coming up, I do wish you all the best. For those of you who have just sat the exam, fingers crossed, I hope it went well for you. Stay safe wherever you are and stay well. And I think Beth will be with you next Tuesday It will be at a different time in the afternoon, 2 o'clock. That's London time in the afternoon. Take care, guys. Thanks for watching. Look after yourselves.